Edutainment Studios welcomes you to osteoporosis, bone weakness. Osteoporosis is a disease that weakens bones to the point where they break easily. Most often, these are the bones in the hip, backbone or spine, and wrist. With osteoporosis, you may not notice any changes until a bone breaks. In actuality, your bones have been losing strength for many years. Bone is living tissue. To keep bones strong, your body breaks down old bone and replaces it with new bone tissue. Sometime around the age 30, bone mass stops increasing. Therefore, the goal for bone health is to keep as much bone as possible for as long as possible. As people enter their 40s and 50s, more bone may be broken down than is replaced. In this course, the objective is to help you learn some things that you can do for your osteoporosis. The focus in our society now is on dairy-free food sources of calcium. Foods good for the bones are broccoli, leafy green vegetables, tofu, almonds, beans, and sesame seeds. When you eat a lot of dairy, the body pulls calcium from the bones to try and neutralize the acidity. That is not good for the bones. In addition to dairy, acidic meat, sodas, added sugars, alcohol, and packaged foods should also be consumed at a minimum. Good bone health can be contributed to a healthy diet. Try to eat fresh, whole foods, and make your meals from scratch when possible. It's not always easy, but you will be better for it. You should also make a habit of eating 6 to 9 daily servings of fruits and vegetables. Chemically similar to calcium, strontium is considered a valuable source to support healthy bones. The main food source for strontium is seafood, such as shrimp, clams, crab, and lobster. Other sources include wheat bran, poultry, and root vegetables like sweet potatoes. Whenever possible, cut back on coffee and switch to herbal tea, or at least limit your caffeine intake. Coffee is acidic and full of caffeine. Although it is a great stimulant, it does hinder calcium absorption. Every precaution should be taken against the body leaching calcium from the bones, making them porous and brittle, and more prone to injury. Salt should be avoided, as sodium is reported to increase calcium loss in urine. Also try to keep your stress levels in check. The stress hormone cortisol is a steroid. Over time, high levels of steroids can increase the risk for osteoporosis. Meditation or Tai Chi are great methods of stress relief. The best way to keep your bones healthy is to exercise. Weight-bearing activities like jogging, jumping rope, and dancing are recommended because they place a higher load on your muscles, tendons, and bones, which respond by getting stronger. Lifting weights has the same effect, so dust off your dumbbells and give it a shot. Start by taking short walks if you don't want to begin too aggressively. Even 10 minutes a day can be beneficial. Soft drinks, champagne, and sparkling water can extract calcium from your bones. Carbonated beverages also contain excess phosphates, which leads to even more calcium loss. Consuming excess protein is known to cause acidity in the body, which leads to calcium loss through the urine. Commonly used medications for heartburn work by blocking stomach acid production, but adequate amounts of stomach acid are needed to absorb minerals such as calcium, magnesium, and zinc. The use of these types of drugs can increase your risk for developing osteoporosis as a result. The best source of vitamin D is simply spending some time in the sun. When the sun rays hit your skin, your body produces vitamin D. The best part is that it is free. This vitamin is very important for the absorption of calcium in the gut. Vitamin D is also important for immune system modulation, combating depressive symptoms, and regulating autoimmune disorders. Adequate levels of hormones are required for proper bone maintenance. Menopause, which decreases estrogen in women, and andropause, which decreases testosterone in men, are common reasons for bone loss. Other bodily hormones may also play a role in bone loss if they are not at optimal levels. Seeing your doctor regularly will catch these decreases in various hormone levels and prompt treatment right away. Certain foods in your diet may be contributing to excess bone loss. These may include refined sugars and starches that elevate insulin levels and cause increases in osteoporosis. An ideal diet is a low glycemic index diet, which are foods that turn into sugar quickly after consumption. Low glycemic index foods do not raise blood sugar or insulin levels quickly. Therefore, they do not cause large fluctuations in insulin levels. Low glycemic foods include lean proteins, beans, vegetables, and good fats like nuts, olives, olive oil, fish oils, and avocados. Eating foods that are high in fiber is another great way to lower sugar and insulin levels, as well as lower cholesterol. Cortisol is a hormone in your body that increases in time of stress. If the levels of cortisol remain high for prolonged periods of time, they can cause bone loss. Relaxation techniques such as yoga, tai chi, meditation, and massage may help decrease cortisol levels. Also, getting adequate sleep, taking a vacation, or even getting psychotherapy, if the doctor recommends it, should be considered if you think you are becoming overly stressed. Moving your muscles helps to stimulate bone strength. Any weight-bearing exercises such as walking, hiking, climbing, and weightlifting can help increase bone density. Exercising for as little as 15 to 30 minutes a day can do wonders. When lifting weights, it is important to not overexert yourself. Staying safe should be your top priority. You can also use your own body weight for exercises. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 3 of 4 on osteoporosis, and please join us for Part 4.